tonight.
As I was sleeping, I could feel racing and pounding of my chest.
An ABC 27 special presentation.
And then I could literally see the light. It was there, I was staring at it. And there's nothing I could do about it. My body was not functioning. I was in cardiac arrest.
Heart to Heart, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. February is dedicated to keeping your heart healthy, a month focused on ways to keep your heart ticking without skipping a beat. And that's important. Heart disease is the #1 cause of death for men and women in the United States. More than 600,000 people die each year because of a bad heart. That's about 1 in 4 deaths. Do you know the early warning signs and symptoms of a heart attack? What happens when you go into heart failure? What are your options? And how do you become a candidate for a heart transplant? You will find out tonight. And if you have questions at home, Christina Butler is here to tell you how to get them answered. Hi, Christina.
Hi, Deborah. Specialists from Penn State Health, Milton S. Hershey Medical Center are here in the ABC 27 call center. They are ready to answer your questions from now through 8 o'clock. Just call the number on the bottom of the screen, or you can email your questions during the show to questions@abc27.com. Structural heart coordinator and nurse practitioner Ashley Heatley will answer your emails throughout tonight's show. All calls and emails are confidential. Our phones are already ringing here. We'll be back later in the show to let you know what viewers have questions about.
Thanks, Christina. A Lebanon County man was shoveling snow on a cold, wintry day. He experienced some pain afterwards and took some medication to treat it. When that didn't work, he knew it was something more serious. Here's Dave Peterson's journey. 53-year-old Dave Peterson is an avid archer.
I would have an 8-point average most of the time when I shot.
After years of perfecting his aim, now Dave teaches the sport to children.
I love taking the kids to their championships and watching and seeing them compete and make new friends. And I realized they're doing everything I had done, and they're having a blast.
A true passion of his, but Dave had to put the bow and arrow down for months. An unexpected break. It happened after shoveling snow.
My breath was gone. I couldn't breathe. And I thought, there's something else. But when I went back in the house, it just wasn't getting any better.
And he came in and he said to me, "I don't feel good." I said, "What's the matter?" He said, "I think I have a gas bubble."
It was staying this time. It wasn't going away. And it was kind of scary.
I said, "Dave, you're having a heart attack." He said, "No, I'm not."
I didn't think it was a heart attack because I had no pain down my left arm at all.
After taking over-the-counter medicine and not feeling any better, Dave knew it was more serious.
He was back in the bedroom for about 15 minutes. He came out and he said, "I think you're right, it's time to go to the hospital." Took him into the hospital, and before I even parked the car, they had him back in the room. And the doctor came out and he said to me, "We're going to put you in the waiting room. We have to put stents in his heart." He said he actually had a Widowmaker heart attack. He'd have waited half an hour to come in. He said we'd been picking him up in a hearse. That was rough.
The culprit for the heart attack was what's commonly known as the Widowmaker, which is the most significant blood vessel that delivers blood to the heart. And sudden acute occlusion of this vessel results in significant loss of heart muscle, which is what a heart attack is.
When that happened, it led to significant heart failure without any recovery, even after they tried to open those arteries.
They came in and said, "Look, just part of your heart just is not going to work. It's dead, basically."
It was bad. It was bad. They weren't sure at first when or if he was going to go home, because the left side of his heart was dead.
His heart failure was initially managed medically with oral medication, and subsequently required intravenous drugs to stimulate the remaining parts of his heart which were viable to take over the function that was lost through the heart attack.
The medication allowed Dave to go home, but the quality of his life was failing.
I had a walking stick and I'd get 10, 20 feet at a time. And I would be sucking air at the end of that 10 feet. It was horrible.
He was in a critical situation, and to the extent that his heart was at the limit of what it could do with our support, but his organs were functioning, and he was an ideal candidate at that time for us to intervene and implant a mechanical heart pump for him.
So they said about the LVAD. I'll admit I said no at first.
An LVAD, a left ventricular assist device, is a type of device that's used to support the circulation. It's a mechanical heart pump.
I mean, I didn't want to do it. I fought kicking and screaming.
This was all a new diagnosis, a recent heart attack, for him, no issues previously. And now, 2 months later, he's being told that he needs to get a LVAD.
We talked about it, and I just said to him, you know what? It is your heart, your body. You got to know what you want to do. I said, I know what I want you to do, but you got to do what you want to do.
My son threatened to tell my granddaughters that I gave up and wasn't getting the device. I'll take a lot, but he's not telling them that, so I'm getting a device. He's not going to tell them I gave up.
That threat convinced Dave to say yes to the surgery.
So this is an image of the heart or the left ventricle where the pump inflow cannula is placed here. And it's connected to an electromechanical motor, and that will basically draws blood from the left ventricle, pressurizes it, and the blood leaves the pump through the outflow part to the aorta, which is the main blood vessel that comes out of the heart. And there's a cable, electrical cable, that comes out and goes through the abdominal wall and connects to the external component, which is a controller and a battery supply.
It was 4 hours sitting there wondering, what's going on? Why is it taking so long? And it was just nerve-wracking.
Tina wasn't alone waiting for the results. Dave's students wanted to know what was happening too.
They all were there when I was getting the LVAD. They actually would come in and visit, and that would lift my spirits to help me through.
Dave spent about a month in the hospital.
Within a week or so, I'm up walking laps around the room in the hospital and stuff. And it was great. I mean, you felt like Superman after this one in.
Less than a week after he left, he was back at the archery club coaching again.
I think he's healthier now than he was before. It made a really big difference.
I feel pretty good. I didn't think a year ago I would be saying that at any time, but yeah, I feel real good. This has just become a part of me.
Dave has had the LVAD for about a year and a half, and as you can see, he is doing great. An example of doctors giving Dave the health he needs to live the way he wants. And he certainly is living the way he wants. Now joining us is Dave's surgeon, Dr. Baize Soleimani, the surgical director of heart transplant and mechanical circulatory support. Thanks for being with us.
Thank you.
The LVAD has made a huge difference for Dave. How long has this been an option?
So LVADs have been around since the 1970s, and in fact one of the very first LVADs was developed at our institution, Penn State, in the 1970s. And since then they have obviously developed and progressed to the current generation that we have available.
And how have they changed in size and effectiveness?
So the LVADs have become progressively smaller and more user-friendly and much more reliable and durable, such that patients who receive this treatment are having what we call near normal quality of life.
And how long can patients stay on an LVAD? Is it really more of a next step is transplant surgery?
In some patients, an LVAD is what we describe as a bridge to transplantation, so it keeps them alive and well until a suitable donor becomes available. In many patients, it is what we call a destination therapy, where patients live on this device for the rest of their lives. And in a small number of patients, the device is a bridge to recovery, and the heart recovers as a result of being rested on LVAD support, and we are able to go in and take the LVAD out and let them live with their own heart for the rest of their lives.
Okay, Dr. Soleimani, thank you so much. Lots of really good information. Now let's check in with Christina Butler in the call center. How's it going there, Christina?
Hi, Deborah. The phones are busy over here. We're getting some pretty consistent phone calls. A reminder that you can call in with your question. The number is 717-346-3333. Here to answer our viewer questions tonight is cardiologist Michael Pfeiffer. And here is our first viewer question. They write, my mother has a history of heart problems, and there are some on my father's side of the family as well. Are serious heart issues hereditary, and what are the symptoms of a heart attack?
Yeah, well, we know that heart issues can be hereditary, but often there's not a test that gives us an absolute risk. So instead, we'll focus on things like what condition did they have and what age did it start. That helps us know whether a test or routine follow-up is most important to help assess those things.
Okay, thanks so much. That viewer also asked about heart attack symptoms. Those are on the screen. And a reminder that you can call in with your question, or you can email your question to questions@abc27.com. Stay with us. We'll be right back.
You're watching Heart to Heart on ABC 27, sponsored by Penn State Health.
Welcome back. A York County man didn't find out he had a form of muscular dystrophy until he was 30 years old. It was discovered after he had 2 strokes. One very important muscle was also affected, his heart. Here's Anthony Bolano's journey. 39-year-old Anthony Bolano coaches his son Isaiah's Little League baseball team.
When I was a kid, I enjoyed playing baseball and actually enjoyed coaching. You know, even as a player, I was kind of the player that enjoyed to coach.
Anthony never missed his son's practice or a game until June 2017.
It was like 2 or 3 days before our championship game. So that was the first time he ever practiced or played a game without me.
Anthony was at Penn State Health when Isaiah played in the championship game and scored the winning run. In the meantime, Anthony had his own battle to win.
So he has a muscular dystrophy referred to as Lang muscular dystrophy. And that affects some proteins of contraction, and it'll affect not just the muscles in his body, but also his heart muscle. His heart muscle had become progressively weaker. And one of the ways the heart compensates for becoming weaker and less efficient is by getting larger.
Doctors implanted a defibrillator years earlier to make sure his heart stayed in rhythm. But one night it didn't work.
As I was sleeping, in my dream maybe, I could feel like a real racing and pounding of my chest, and it was like out of control. I had lost control of my body, and I didn't really know what was going on, whether I was dreaming, what was going on. And then I could literally see the light, like that people say that it was there, like I was staring at it.
He went into a life-threatening heart rhythm change, and the defibrillator was unable to get him out.
All of a sudden, I felt my body get electrocuted and shocked, but did nothing. Got shocked again, did nothing. Got shocked a third time, did nothing. And then all of a sudden, I don't know, the will of God or, the power to be, whatever it is, my body came to, and I jumped, kind of sat back up.
What he knew is he got shocked, and we were able to pick that up by our remote monitoring as well. He didn't know that the defibrillator really didn't do it. He came out on his own.
Anthony immediately went to the hospital. There he received some unexpected news.
The first time I ever met Dr. Baize, he said, "We got to get you a transplant." It's one of the first things he ever said. He said, "Medicine is not going to change this. The only way to get you healthy was a transplant."
If we did nothing, one of 2 things happened. Either you die suddenly from a bad rhythm, or you progressively get weaker, more fatigued, more short of breath, and die from not enough blood flow. And he was going down the path that one of those two was going to happen.
So Anthony was placed on the heart transplant list. Last September, he checked into the hospital with one goal.
So I checked in on September 11th with the goal that I wasn't coming home until I received a heart. Our goal was to get our heart before Christmas.
Less than 3 weeks later, Dr. Baize delivered the news.
And I'm just sitting there getting ready to eat lunch, and he walks in and he said, "We got a heart match and it looks really good. I'm not saying it's a definite yet, but it looks really good. Don't eat your lunch." About an hour and a half later, come by, and he came in and he said, it's going to be a go late tonight, so you can go ahead and start calling people.
It was a donor that fit him very well, was a very good quality heart, was at a young enough person that we were confident it was going to work well.
Anthony's case went very, very smooth, and there's no delay at all. The time was 2 hours and 30 minutes for his case. It was very quick and really fortunate, actually. Everything went well.
I felt, I think, immediately better. Like, my whole body felt better.
He got up fairly quickly, started moving around fairly quickly, and then has kept himself active. He's actually doing better than we anticipate from that regard.
I actually stood up and was on my feet on day 2, which isn't very common. I started walking on day 4.
The heart is doing beautifully. We're very happy with the heart function, and we anticipate Anthony will do very well.
He left hospital only 11 days after surgery, so it was really quick and nice recovery he made.
12 days after the life-saving operation, Anthony was home.
I feel like I have energy that I've never had in my whole life that I remember. I feel like I could go do things that I could never do in the last 39 years of my life.
Anthony already knows how he's going to use this newfound energy.
I'm going to race the kids around the bases for the first time ever. They might not like the new extra energy coach, Anthony. We'll find out.
We'll certainly find out. He is really doing a wonderful job. Doctors diagnosed Anthony's son with the same muscle disorder. At age 3, doctors gave Isaiah medication so his heart will stay a normal size. Anthony hopes his son will never have to go through a heart transplantation. Joining us now are heart transplant coordinators Taylor Hodges and Alex Shui. Thank you so much for being with us.
Yeah,
such a touching story, Taylor, when you watch that, what Anthony has gone through. What a great outcome. What was going through your mind when you watched his story?
Anthony's story is great. He's done really well since he's been transplanted. He's now at home doing what he wants to do, and it's great. Alex and I got to see him when he was with Dr. Baize, going through the whole transplant process and evaluation before he got to transplant, and he's just doing really good. It's nice to see him get a second chance at life.
Alex, why don't you tell us, as a transplant coordinator, what is your role?
So as transplant coordinators, we're with patients through the entire journey. We first meet them when their heart failure is so severe that they're being worked up for a heart transplant, and we continue to manage them while they're on our wait list. It's at that point that we really encourage patients to think about their goals and what they want to get back to doing after they get their new heart. Because a lot of these patients are so sick that they can't do the things that they love to do anymore. So it's really important to give patients something to look forward to. And after they get transplanted, we essentially follow them for the rest of their lives.
And while they're waiting, Taylor, that must be a very difficult time. I know it was for Anthony. You just sort of watched the clock, waiting and wondering.
So the waiting time for somebody that's listed for heart transplant is different. There is no definitive timeline when someone will be transplanted. We tell everybody in our education to make sure that they are ready at any time to accept a heart when it is available. There's multiple factors that go into being listed for heart transplant also, such as blood type, height, and weight.
Alex, getting the heart is the first step, and that's a huge accomplishment, but there's certainly a lot of follow-up care.
Right. I would say that Taylor and I actually spend the most time with patients after they get transplanted. We do a lot of education with patients and their families even before they get discharged from the hospital. We go over things such as lifestyle changes that they need to adopt and new medications that they have to be on to prevent rejection of their new heart. After patients get discharged from the hospital, that's really when we get to see them back in their elements, back doing the things that they love to do. And that's truly why we do this job.
Yeah, I was going to say, and to watch Anthony and his follow-up, I mean, it really must warm your heart.
Yes, very much.
It is.
Thank you both for being with us tonight.
Thank you.
And if you would like more information, or if you would like to refer someone to Penn State Health Heart and Vascular Institute, this is the number to call, 717-531-4554. And let's go back to the ABC 27 call center. How's it going, Christina?
Hi again, Deborah. It's busy over here. Let's get right to our next viewer question for Dr. Michael Pfeiffer. They write, I am in my 40s and relatively good shape. I exercise, avoid fast food. I do not smoke. Are there other risk factors I should know about?
Well, first of all, they're doing a great job. If you can say that you're eating well, exercising regularly, and not smoking, you're already addressing a lot of the things that we know are helpful. You know, other things to think about are making sure that you are aware of high blood pressure, high cholesterol, or high sugar, and those things would be things you'd follow up with routine health visits.
Okay. And we have another question here. These questions are pouring in tonight. They write, a couple of weeks ago, I felt some sudden pain in my chest and the left side of my body. It passed pretty quickly, but I wonder if I should still go see a specialist.
Well, if you're already established with a cardiologist and you had symptoms like that, I would definitely follow it up with them. If you don't have a cardiologist, talking with your primary doctor, making a decision together about whether a specialist visit would be important is a good idea.
Okay, don't ignore that pain. Thank you so much, Dr. Pfeiffer. Thank you also to our experts who are in the ABC 27 call center tonight answering our questions. Deborah, back to you.
Thanks, Christina. Joining us now is Keith Mowry and his wife Jane and Dr. Vassal Aziz. Thank you both for being here with us this evening. Keith, you look great. 82 years old, perfect shape, but that was not the situation 5 years ago. Talk to us about what happened.
5 years ago, I got awake in the middle of the night with severe stomach pain. And after a bit of time, I got my wife awake and said, I think we have a problem. And we ended up going to the local hospital. And from there, we were transferred to Hershey.
Lifeline brought you down to Hershey. Dr. Aziz, what was his state when he arrived here?
So Mr. Maury, when he arrived, he was unstable. His blood pressure was very low, and our diagnosis was that he was actively bleeding from a ruptured aneurysm. And for audience, the aneurysm is described as enlargement of the artery. So I can simplify it by saying it's ballooning of the artery. So if we keep inflating air in a balloon, it keeps getting bigger and bigger, and ultimately it pops. Same principle applies to the aneurysm. And Mr. Maury's aneurysm was pretty large. It's about 8-centimeter aneurysm.
Jane, what was going through your mind?
I knew that he felt terrible. We'd never gone to the emergency room otherwise. But I had no idea his condition was as serious as it was.
Dr. Aziz, what needed to be done?
So at that point in time, he was actively bleeding. And what we offered him was that we will have to stop bleeding surgically, and we will do whatever it takes to stop the bleeding.
And tell me, Keith, what was sort of going through your mind? Could you believe this was happening?
I think I didn't realize how serious the whole thing was. I think I just was told I was going to have a serious operation, and my chances weren't really very good, but it didn't register. It just did not.
And Dr. Aziz, tell me about the surgery, what you had to do.
So his aneurysm was complicated. He had a ruptured iliac artery aneurysm. So to simplify, there's a big artery which had 2 branches going down, and our goal was to stop the bleeding from the branches as well as the main artery. So we ended up putting plugs in the outflow branches, and then we put stents in the artery which was giving the blood to the ruptured aneurysm. After that was done, he had lost about 12 units of blood, and he had so much blood in his abdomen that was pushing his lungs and guts towards one side. So we had to open his abdomen to decompress, and we closed him up about 2 to 3 days later.
Wow, obviously the surgery went very well. You did a fantastic job, Dr. Aziz. That was 5 years ago. You went to a rehab for a couple of weeks, but now 5 years later you're doing great. How do you feel?
I feel fine.
Old, but fine.
And Jane, what do you think?
I think it's just great to have a husband. I wasn't ready to be a widow.
And Dr. Aziz, are there any early signs that viewers could think about as far as watching out for?
So the recommended guidelines are that men above 65 years of age who have either family history of aneurysms or who are active smokers should be screened with ultrasound to detect the aneurysms. The surgeons can fix it better before they're ruptured.
Okay. Thank you guys for being with us and sharing your story. We appreciate that.
Thank you.
And we also want to thank you, our viewers, for sharing your stories and sending in your questions. If you would like more information or if you would like to schedule an appointment with Penn State Health Heart and Vascular Institute, call 717-531-4554 or visit online at hmc.pennstatehealth.org/Heart and Vascular Institute. Thanks for watching, and we wish you good health.